Dear chairs, ladies and gentlemen, it's really a great honor for me to be here to give an overview on the global epidemiology of hepatitis B and hepatitis C infection. From this morning session and also from previous work in this field, maybe I think most of you have been working in this field for many, many years. We all understand that viral hepatitis, especially hepatitis B and hepatitis C chronic infection, cause great public health problem. So first of all, I would like to talk about the global prevalence of hepatitis B infection. These slides illustrate the current epidemiology of hepatitis B. We can see global population around 6 billion, around 2 billion people have been infected by hepatitis B. Among them, 300 to 400 million with chronic infection of chronic hepatitis B. And among them, 15 to 25% will eventually die of liver cirrhosis and CC in lifetime. In this sense, each year, maybe around 1 million people died of HBV-related disease, including liver failure, cirrhosis, and HCC. So these slides show the WHO regions. It divided in the world into 6 regions. So I will give a brief summary of the prevalence of the surface antigen worldwide. In general, we can see around 3.6% worldwide people. Then it is not evenly distributed. We can see that in Africa, in the West Pacific region, and Eastern Mediterranean region, and some part of European countries is high. Whereas in general, North American and European countries are relatively low. Now, first we look at the European countries. In these regions, in general, around 2% of population have positive for surface antigen. Whereas even among this, there is a high prevalent area, intermediate, and then most of them, of course, low prevalence, less than 2% of the total population. So in general, hepatitis B chronic infection is less problematic in this region, whereas the hepatitis C may be more problematic. I will mention a little bit in the later part of my talk. We can see in general, this from 5 countries, we can see the prevalence of hepatitis B declining steadily. That's a general trend, like in other parts of the world. However, if we can now see that the prevalence in some specific population, in the right panel, we can see in persons who inject drugs, then the prevalence should be much higher than general population. This would be one source of the problem, and also maybe another problem is the immigration from other endemic parts of the world. So now we can see the American, the regions of American, less than 1%, even lower than the general population. But still, there are very few countries like Haiti have higher prevalence of surface antigen, and most of them have intermediate and low prevalence of hepatitis B, like in United States, Canada, and some other North and South American countries. However, in the United States, immigration will cause some increase in the prevalence of hepatitis B. The left panel is the number of patients, the number of the immigrants from other parts of the world. The right panel is the persons immigrated with hepatitis B surface antigen positivity. We can see the total number of Asian immigrants is a second large number next to the Central American, whereas the total number of surface antigen positivity imported is the highest. So this will be cause some specific problem. Now let's look at the Eastern Mediterranean region, around 3%, so it's relatively low. We also have some countries high, like Sudan, Somalia, and Yemen, and the intermediate prevalence like Libya, Oman, Pakistan, Saudi Arabia, and some other countries. We also have low prevalence in this region, like Afghanistan, Egypt, Iran, and among other countries. So once this area is high to intermediate epidemicity, but now it becomes low to intermediate endemicity. So African, it's, as I mentioned earlier, is the highest prevalence, have nearly 9% of population are positive for surface antigen. We also have high, most of the countries we can see the higher prevalence. Then also have a few countries less than 2% or between 2 to 8% of population. So like South America in the intermediate region of this area, where we know that's the resource-constrained countries in most area of this part of the world. Then in Southeast Asian regions, there is also around 2% of population are positive for surface antigen. Most of them in low or intermediate region of prevalence, like Bangladesh, Bhutan, Myanmar, Sri Lanka, and Thailand. Whereas in India, Indonesia, and Nepal, they belong to the low prevalence in surface antigen. So lastly, but most important, is I would like to emphasize the Western Pacific region, where I came from. There are around 5% of population are positive for surface antigen. As we know, this region also has a populous part of the world. The large number of people inhabited there. There are some countries higher than 80% of surface antigen, like Vietnam, like Mongolia, and intermediate areas like China, which is, has the largest population in this region, maybe also in the world, definitely in the world. And the low area like Australia, Japan, and Malaysia. So from this slide, previous slide, we know an overview of different parts of the WHO regions. Now we see the changing. I will not say too much about this, but we see that from the past 20 years or 2 decades, we can see the declining in many parts of the world. This is mainly due to the increasing coverage of vaccination program against hepatitis B. We can see in 1990, only 1% of coverage, whereas in 2014, we have over 80% of coverage. Therefore, the decrease in the prevalence of surface antigen mainly contributed to the vaccination program. For example, in mainland China, we can see the increasing HPV vaccination coverage from 1992 to 2011. We can see both the birth dose vaccination and the full 3-dose vaccination increased steadily, over 90% in the last several years. So this translates to the dramatic decrease in the young population, the surface antigen. You can see 20 years ago, we have general population around 10%, 9.7% in general population, whereas in the 2006, we have the prevalence in general population around 7%, whereas in those who are younger than 5 years old, less than 1%, already achieved the goal by the West Pacific Office of WHO. Then even more dramatically, that the new data released just last month, I think 2 months ago, we can see declining surface antigen even further in young generation. We can see the blue bar, you can see that's the data survey from last year. You can see in those less than 4 years, the prevalence only 0.3%, whereas between 5 to 14 years old, less than 1%. Even those under 30 years old, less than 5%. So this is a newly unpublished data, but already officially released by the government. So I just show this slide. So in the next part, I will just very briefly talk about prevalence of hepatitis C virus infection. So we already know worldwide there are a lot of people infected by chronic hepatitis C. I won't go over these slides, but we can see schematically in this map also Mongolia and other parts of the world have very high prevalence of anti-HCV positivity. That's the data from 2005. Whereas we can see in injection drug users, the prevalence was much higher. You can see in some part of the world, even higher than 80% in some countries. So in general, this contributes a lot to the prevalence in the general population. So this slide just schematically shows the HCV genotype. I won't go through too much details about this. And again, we can see dynamic changes of hepatitis C infection, whereas in 1999, the overall prevalence around 3% worldwide, whereas now around 2%. 1% drop in the global population will translate into a large number decline in the patients. Again, this is just a specific cases. We can see that in the different part of the regions have different prevalence of HCV infection. In general, in Middle East, in some part of the Asia, like Mongolia, they have the highest prevalence of HCV infection. Well, this is also have age related. In general, in old age, the prevalence of anti-HCV is much higher than the young generation. Here it just shows the data from mainland China again. That we can see the red line show the data from the survey carried out in 1992. You can see around 3.2% in general population were positive for anti-HCV, whereas the data show from the 2006 is declined to 0.43%. There's a sharp declining. I think this mainly contributes to the mandatory screening for blood donors for hepatitis C, whereas there may be also some other explanation, maybe due to the specificity of the region to test anti-HCV. There are also some other professors may argue this may be a little bit underestimated the prevalence because the survey did not include the high-risk population, just the general population. So some estimated may be higher than this. Again, this slide shows that reported cases does not mean the incidence, but the newly diagnosed reported cases increasing in the past years. Again, show the disease burden would be still very high, although the new infection become less and less. So in summary, we can see both hepatitis B and hepatitis C really pose a very serious public health problem worldwide, especially in Africa and the West Pacific region and some part of Middle East. Fortunately, WHO responds to this kind of change. As mentioned in this morning, I won't go through too much details, but two landmark works will be the release of HCV guideline and HBV treatment guideline. The two guidelines really will improve the prevention, diagnosis, as well as the treatment of hepatitis B and hepatitis C worldwide. Specifically, of course, I hope they will improve the work in the region of West Pacific region, including mainland China. Thank you for your attention.
Thank you. Dr. Jia's presentation is now open for questions or comments.
Jia, I wanted to have you comment a little bit more on under-surveyed high-risk individuals. We had a publication that just came out in Hepatology about a week ago about the US estimates potentially being higher because of the under-survey and just resource issues of testing the right people or the people who are infected. Where would you go in China to test those people?
Well, as I mentioned, and also you correctly point out, for hepatitis B, it would be not a big issue, but for hepatitis C, we understand in China, at least in mainland China, the drug users, patients on hemodialysis, and some other specific groups maybe contribute a lot. According to some calculation, maybe if we include all this kind of high-risk population, then the translated general population would be around 1% of the anti-HCV positivity. So there are no nationwide survey on this, but we have some specific sporadic series report. We also have kind of estimation of the total number of high-risk patients. So by doing this, we can figure out roughly it should be higher than 0.43%. But we have no very, very good, better figure to show the nationwide picture.
I think we need an investment to test these high-risk people.
Yeah, yes, very good point. But again, this sometimes is kind of just due to limited resource, but sometimes due to this sensitive issue in mainland China, this kind of people wouldn't like to be tested, even they know they are positive for this for HCV or HIV.
Great point.
Thank you.
Thank you, Dr. Jish.
My question only is with regards to the prevalence of HBV on the slide that you showed, Doctor. Philippines is included in 2 to 8% prevalence. Which study are you basing, which WHO, what's the basis, basically, is the question, of this estimate?
Well, I just use, frankly speaking, I haven't have the source data, but I have just cited the recent review published in the several top journals like Lancet and also Hepatology. I have no any specific, I didn't do any specific research on the individual cases in the countries.
Number 3.
I'm Kelly Seyfried Harmon with Hepatitis Medicine and Policy. And my question is about the global epidemiological evidence. Where would you say the most problematic gaps are in the evidence? And what are your thoughts about how those gaps need to be addressed going forward?
Well, for hepatitis B, I think we have the relatively, at least in China and other neighboring countries, we have relatively good evidence, good data to show the prevalence, and also have the evidence to show the efficacy of immunization. Dr. Ni will address. But for hepatitis C, maybe a major problem is underestimation, as mentioned by the Dr. Robert Gage. Then in this area, because the patient usually have no symptoms or symptoms very mild, and they are neglected. Even the people know even fewer about less than the hepatitis B. I think that's the major problem.
Okay.
Thank you.
Okay, the last question from microphone 4.
Oui, moi je vais poser ma question en français. Si vous pouvez porter casque. Ok. Et c'est tout juste pour savoir. Dans le monde, on a environ 350 millions qui sont porteurs de l'hépatite B et environ 18% sont porteurs de l'hépatite D. Et dans le programme, on n'a même pas fait mention de l'hépatite D. Par contre, on sait que les pays africains et les pays asiatiques, le taux de prévalence de l'hépatite D est très élevé. Est-ce que vous pouvez nous donner quelques chiffres sur l'hépatite D en Chine et dans la région asiatique? Merci. C'est folie.
Well, for the question, I understand the question. Like me to give some figures of hepatitis B in China and other Asian countries. Well, in China, we have relative detailed data. We have already 4 times national survey of zero prevalence of hepatitis B. In 1992, it was 9.75% in general population, whereas in 2006, it declined to 7.18%, whereas last year data we're showing, we have no general population, but those on the 30 years old, maybe less, around 4 to 5%, or even lower. Because the younger, the lower in the prevalence. For I know some data from Mongolia, Republic of Mongolia, they have a prevalence of both hepatitis B or hepatitis C, both are more than 10%. So this is really high prevalence in this region.